Namaskar. Welcome to my YouTube channel. Today we are going to discuss about Aiims Norcet previous year related question answer. Part 1. Let's start. The first question. What is the primary clinical indication for the administration of oxytocin, pitocin in the third stage of labor? Option A. To prevent postpartum hemorrhage PPH. Option B. To hasten the repairing of the cervix. Option C. To relieve labor pain. Option D. To induce labor contraction. The correct option is option A. To prevent postpartum hemorrhage PPH. A nurse is caring for a child with tetralogy of Fallot who suddenly develops a tear spell cyanotic episode. Which position should the nurse place the child in? Option A. High Fowler's position. Option B. Knee chest position. Option C. Prone position. Option D. Supine position. The correct option is option B. Knee chest position. Identify the primary purpose of using a Z-track technique during an IM injection. Option A. To allow for faster absorption of the drug. Option B. To prevent the medication from leaking into the subcutaneous tissue. Option C. To ensure the needle reaches the bone. Option D. To make the injection less painful for the patient. The correct option is option B. To prevent the medication from leaking into the subcutaneous tissue. Which electrolyte imbalance is most commonly associated with the Quastic sign facial twitching? Option A. Hypocalcemia. Option B. Hyperkalemia. Option C. Hyponatremia. Option D. Hypomagnesemia. The correct option is option A. Hypocalcemia. A patient is scheduled for an intravenous pyelogram IVP. Which allergy is most important for the nurse to assess prior to the procedure? Option A. Allergy to sulfur drugs. Option B. Allergy to penicillin. Option C. Allergy to iodine. Option D. Allergy to latex. The correct option is option C. Allergy to iodine. Which of the following is an early sign of increased intracranial pressure ICP in an adult patient? Option A. Posturing, decerebrate or decorticate. Option B. Cushing's trait. Option C. Altered level of consciousness LOC. Option D. Dilated and fixed pupils. The correct option is option C. Altered level of consciousness LOC. What is the primary reason for the administration of vitamin K to a newborn within the first hour of birth? Option A. To prevent hemorrhagic disease of the newborn. Option B. To prevent neonatal jaundice. Option C. To stimulate the baby's first bowel movement. Option D. To enhance the absorption of calcium. The correct option is option A. To prevent hemorrhagic diseases of the newborn. Identify the priority nursing action when a patient chest tube accidentally become disconnected from the drainage system. Option A. Immerse the end of the chest tube in a bottle of sterile water. Option B. Cover the site with a dry sterile dressing. Option C. Clamp the chest tube immediately. Option D. Call the healthcare provider before taking any action. The correct option is option A. Immerse the end of the chest tube in a bottle of sterile water. A patient with chronic obstructive pulmonary disease COPD is receiving oxygen therapy. Which device is best suited to deliver a precise low concentration of oxygen? Option A. Non-rebreather mask. Option B. Simple face mask. Option C. Nasal cannula. Option D. Venturi mask. The correct option is option D. Venturi mask. Which of the following position is most appropriate for a patient immediately following a liver biopsy? Option A. Tyndallberg position. Option B. Semi-Fowler's position. Option C. Right lateral position. Option D. Left lateral position. The correct option is option C. Right lateral position. In the rule of nines for calculating burn surface area in an adult, what percentage is assigned to the entire right arm? Option A 9%, option B 18%, option C 4.5%, option D 1%. The correct option is option A 9%. Identify the purpose of the Murphy's sign assessment in a patient complaining of right upper quadrant pain. Option A. To detect appendicitis. Option B. To detect renal calculi. Option C. To detect cholecystitis. Option D. To detect splenomegaly. The correct option is option C. To detect cholecystitis. A nurse is assessing a patient with a head injury and notes clear fluid draining from the nose. Which test should the nurse perform to confirm if the fluid is cerebrospinal fluid (CSF)? Option A. Check for the presence of protein using a dipstick. Option B. Observe for the fluid to clot. Option C. Perform a pH test using litmus paper. Option D. Check for the halo sign on a sterile gauge. The correct option is option D. Check for a halo sign on a sterile gauge. What is the recommended compression to ventilation ratio for a single rescuer providing CPR to an adult victim? Option A 5:1, option B 15:1, option C 30:1, option D 30:2. The correct option is option D 30:2. A patient is prescribed warfarin therapy. Which of the following laboratory values should the nurse monitor to evaluate the effectiveness of the medicine? Option A. Serum potassium levels. Option B. Prothrombin time (PT) and international normalized ratio (INR). Option C. Activated partial thromboplastin time (APTT). Option D. Bleeding time. The correct option is option B. Prothrombin time (PT) and international normalized ratio (INR). Which of the following is the most appropriate site for administering an intramuscular injection to an infant under 12 months of age? Option A. Deltoid muscle. Option B. Ventrogluteal site. Option C. Vastus lateralis. Option D. Dorsogluteal site. The correct option is option C. Vastus lateralis. A newborn is assessed 1 minute after birth. The heart rate is 110 bpm. The infant has a weak cry, some flexion of extremities, is grimacing during suctioning, and the body is pink with blue extremities. Calculate the APGAR score. Option A 4, option B 6, option C 8, option D 5. The correct option is option B 6. According to the BMW Management Rules 2016, which of the following should be discarded in the red bin? Option A. Used needles and scalpels, blades. Option B. Infected plastics like IV sets and catheters. Option C. Anatomical waste like placenta. Option D. Expired cytotoxin drug. The correct option is option B. Infected plastics like IV sets and catheters. In a patient with a suspected deep vein thrombosis (DVT), which of the following nursing actions is contraindicated? Option A. Applying a warm compression. Option B. Massaging the affected leg. Option C. Elevating the affected extremity. Option D. Measuring cuff circumference daily. The correct option is option B. Massaging the affected leg. While administering a blood transfusion, the patient suddenly complains of back pain, chills, and shortness of breath. After stopping the transfusion, what is the most critical next step for the nurse? Option A. Keep the IV line open with normal saline using new tubing. Option B. Send the blood bag and tubing to the lab. Option C. Notify the physician immediately. Option D. Administer diphenhydramine Benadryl as per PRN orders. The correct option is option A. Keep the IV line open with normal saline using new tubing. Thank you for watching. Please like and subscribe.